Hi, Dr. Michael DiMattina, Medical Director at Dominion Fertility. So today I would like to talk to you about embryo transfer, frozen-thawed embryo transfer. You've already gone through all the work, the IVF, the hormones, the egg collection, the fertilization, hopefully pre-implantation genetic testing on your embryos in today's world. We do that on 100% of our patients. It's so powerful in making babies. So by now the embryos are frozen and you need them transferred in order to make the baby. The last step, embryo transfer. Well, there's two ways of doing it. And one is called medicated frozen-thawed embryo transfer, and the other method is natural cycle frozen-thawed embryo transfer. Which is better? The short answer is neither. They're both medically acceptable and performed by doctors in our field regularly. At Dominion Fertility, virtually 100% of our patients undergo medicated frozen-thawed embryo transfer. Why? Because we can program the cycle and make sure the patient understands in advance exactly the date and the time of the day that her embryo will be transferred. And a lot of people appreciate that and like that. It's reproducible. So if we have to adjust anything for future embryo transfers, we can look at that and say, well, this is what we did last time. We can just tweak it a little bit. So what we do for medicated frozen-thawed embryo transfers, the patient usually starts by taking a little medication to turn her menstrual cycle off, like a birth control pill or some Lupron. And then when her period starts, we stop the birth control pill, and then she takes usually some estrogen pills to develop the lining of her uterus so that the embryo will implant. So those pills are taken for about 2 weeks, and she's monitored a little bit with some ultrasounds to make sure the lining is growing, thickening to a certain depth. And once that happens, we give her progesterone, combination of vaginal progesterone at Dominion Fertility with intramuscular progesterone every other day. And then the transfer is programmed so she knows exactly in advance when it will occur. And I can guarantee her 100% that I will be there as her doctor to do her embryo transfer. So it gives patients a lot of comfort level. I've been doing this for over 35 years, and I like transferring embryos into my own patients. It gives me a lot of satisfaction. And so the other method is using the normal natural menstrual cycle. And there's nothing wrong with that too. But it's less certain because the menstrual cycles, as you know, can vary. Usually somewhere between 26 and 32 days. This is normal. So you don't know exactly the date and the time that embryo is going to be transferred. You have to monitor the patient's cycle. And then once the follicle gets to a certain size and the lining of the uterus, the endometrium, gets to a certain thickness, then we can go ahead and program the transfer. So in the meantime, you don't know. There's a lot of variability in there. So I can't guarantee the patient that I'm going to be there for embryo transfer because it's just purely up to chance what's going to happen in that particular menstrual cycle. But if you do that and put the embryo in a natural cycle frozen-thawed embryo transfer, the pregnancy rates are generally the same as a medicated cycle. The difference is one is scheduled in advance and programmed, which works great. The other one, a little bit less so. There's more uncertainty, and so you can't say for sure what day of the week that's going to occur. Most IVF centers that I know of prefer to do the medicated approach, both for the doctor's schedule and for the patient's schedule. So where I am in Washington, D.C., patients are professionals, they're busy, they have a lot of commitments, and they want to know, Dr. D, when are you going to be there to do my transfer? Well, I'll tell you exactly in advance. So I prefer the medicated versus the natural cycle. The other thing is sometimes we do endometrial receptivity assay. Even the company that has the assay will say you should do that in a medicated, not a natural cycle for the frozen-thawed embryo transfer to assess the lining of the uterus. Where are we with this? So it's sort of to a certain degree with the patient's preferences, but at Dominion, I like to do my own transfers. I have very high pregnancy rates, and it gives me a lot of satisfaction to do that procedure. Matter of fact, other than the obstetrical ultrasounds where I see the baby on the sonogram machine for the first time, the joy that the couple were showing, my next favorite procedure to do in my day is an embryo transfer because I'm putting an embryo in, we're providing hope. And most of the people end up getting pregnant, which is great in this day and age. Dr. DiMattina at Dominion Fertility, thank you, and show me the baby.
Dominion Fertility, making miracles happen, one family at a time.